So when do babies start outgrowing this normal activity, if you will?
Well, once they become vertical, right? So once they're changing from being horizontal and lying down most of the time to actually running around and being upright.
So like 16, 18 months. I'm trying to remember when.
Yeah, by then.
Yeah. Usually when they start to sit up around 7 to 9 months, you start to see an improvement, but it can last, up till they're about a year or so.
All right, so if it continues on after that, are we talking now something a little bit more serious, doctor?
Right, well, there are warning signs that would make you be concerned. Obviously, if the baby is not gaining weight and is throwing up constantly, so that would be a sign that, just a little spit up, like you say, after feeding, after you put the baby down to sleep or nap, which would probably be a good idea to keep them upright for a while before you do that. But if it is normal, but if the baby, if while you're feeding the baby is still throwing up.
Is that Gerd at this point, the gastroesophageal reflux disease?
Once it's becoming, it's causing problems like weight gain, like respiratory problems, coughing, pneumonias, then it becomes more concerning.
All right, so we have actually some symptoms of what is called Gerd, or gastroesophageal reflux disease, a little bit more concerning. So it would be frequent vomiting, doctor?
Right, you have vomiting to the point that the baby's not sustaining his weight or her weight, and it's actually losing weight, so it's not getting enough calories in.
Frequent cough and wheezing, that's certainly not good.
Right, so if the food or the feeding comes back up into the back of the mouth and then can go into the windpipe, it can cause problems, what we call aspiration, where that's actually the food is going into the lungs rather than going down into the stomach.
That's very dangerous, isn't it?
Yes, it can give you pneumonias and give you respiratory problems, and then but you can also have respiratory issues just from the acid going back into the esophagus and affecting what's called the vagal reflex and cause the baby to have respiratory problems that way as well. So,
all right. Some difficulty eating and gagging as well, you would notice?
Right, yeah, that goes along with the aspiration. Yeah,
gas and colicky behavior?
Yeah, any kind of like indigestion, kind of not tolerating the feedings well.
Okay, regurgitation and sour taste in the mouth, which would be from?
Regurgitation is just the feeding coming back into the mouth. And just you notice after you feed the baby has formula back in the back of the throat.